I just want to say something about the medicines we use, especially for depression or OCD. Lot of times people have a lot of misconceptions and misunderstanding about psychiatric medications. I know that every medication is a medication, it gives some side effects. But if you look at very specifically, let me talk about one or two medicines which SSRIs, and very specifically I'm talking about, which is very commonly used. Let's talk about maybe fluoxetine, mainly escitalopram and sertraline. I'm highlighting these two things because I keep writing these drugs. This escitalopram and sertraline, they are very useful in depression. Significant group of patients with depression, they come out of it well. They are useful in OCD also. Even in bipolar depression to a certain extent it's useful. Then what about the side effects, doctor? Let me tell you. Maybe I can single out one drug, escitalopram, maybe sertraline. These medicines given on the alone, I don't want this to be combined with polypharmacies and all things. Monotherapy with these medicines in the treatment of depression, they're reasonably safe. Short-term side effects, they're not very sedating. At the most, they may give a little bit of gastric symptoms, like you'll have a bit of acidity and nausea, which will go in 3-4 days. If at all there's a bit of sedation, that also go maybe in about a week. Patients don't feel sedated. One of the standard things I tell all my patients is that I don't want any of my patients to sleep from morning 7 to night 9. If you don't sleep in the night, it's my responsibility. But daytime, you are not going to sleep. My medicines are not sleeping tablets. I don't want you to sleep. It's a rule in my clinic. They're not sleeping tablets. Initial period, they may get over it. Then sometimes we do have a little bit of problems. Like one of the problems is that 25-30% have a sexual dysfunction. I do agree, but this is dose related. In men, erectile dysfunction, it's dose related. Once we reduce the dose, it subsides. In some patients, we may have to stop the drug. It is temporary. Once I stop the drug, the sexual dysfunction completely disappears. Suppose somebody doesn't have this. Suppose I use this drug for the next 3-4 years, 4-5 years, doctor. Mostly no problem. We do talk about sodium levels being low and rarely some kind of, like in a gastric, like some kind of bleeding, which is extremely rare. You don't see it once in 10 years also. So-called serotonergic syndrome, I have not seen in the last 20 years. So these are reasonably safe tablets. If you don't think that I am pushing it a little bit too much, sometimes I tell my patients, I do even ask in the group of my colleagues, suppose I give escitalopram at the 20 milligram dosage for the next 25 years. Suppose some patients requires it for 25 years. Is there any serious problem with that? Serious side effects? Generally, no, sir. Most of the patients, 95% of the patients do not have any major side effects. So, long-term side effects, virtually no. Even if there is something which are correctable. I don't say that it's a zero. There's nothing, there's nothing in this world which has got a zero side effect like that. Sometimes the food we eat also, it can have its own small thing, and like what we breathe, it will have its own sort of side effects. But as I tell them, just to give them more of a confidence to the patient, this drug may be as safe as paracetamol, which we take left, right and center for any pain. You may think that I am overdoing. No, sir. These are safe drugs. They are very effective drugs. They are safe drugs in the long run. Short term, there are problems which are always reversible. This is one thing why I want to convey is that a lot of patients are morbidly worried about this antidepressant drugs. My God, doctor, I don't want. No, you don't have to. A lot of them, I tell them, take the medicine for 2-3 weeks, 3-4 weeks. If it doesn't help, I'll come back to you. These drugs having a lot of side effects, please no. Don't just Google and then look at the 1,000 side effects which they have. We say that most of them do not have any major long-term side effects. Long-term, major, serious side effects with drug like escitalopram, sertraline are almost not there. Don't tell me 1 in a million or 1 in 10,000. It can happen to anybody, but mostly they are. So why I'm telling is that these are very effective drugs in depression, OCD. They're very least side effect drugs. So I don't want anybody to be deprived of this kind of an advantage, the medical advance what we have. Tomorrow maybe there's some more good medicine may come which shows that if it's in a week, but as on today we don't have. Don't get unnecessarily too concerned, too worried, Googling too much about the side effects, but please take the medicine. Please take the medicines. Give it a try for about 2-3 weeks, 2-3 months, and then you decide. You will be the best person to decide whether the medicine is working for you or not, and your professional doctor, the doctor is best person to discuss with you what are the immediate and long-term effects. This is one clear-cut thing what I want to say, that the medicine is effective, medicine has got the least side effects. This once again I want to re-emphasize that.